Good morning. Happy Monday. It's April 13th, and you're here with us at The Doctor Is In, Ask Dr. Arwady. My name is Sybil Madison. I'm your Deputy Mayor for Education and Human Services, and I am here with Dr. Allison Arwady, your Commissioner for the Chicago Department of Public Health. If you have any questions or comments for the doctor, please put them in the comment box below, and you can also send them through Facebook or Twitter using the hashtag Ask Dr. Arwady. We always start off by checking our social distance to make sure that we're doing well here. And then Dr. Arwady, do you want to give us an update on where things are with COVID-19 in Chicago?
Yeah, good morning everybody, and thanks for joining. So as always, chicago.gov/coronavirus is where you'll find the most up-to-date information about what's happening here in Chicago related to coronavirus, as well as the city's response. They keep updating it, so every time I go on, there's new information, there's new microsites. There's going to be one launching today that's specifically about healthcare workers and the way the city is helping to support healthcare workers. So I encourage you to take a look at that and just generally keep exploring the website. But right up at the top is where you're able to find the latest data. There's a tab called Latest Data, and there's all kinds of things that go up there, and we update it at least once a day. So as of today, there are 8,584 lab-confirmed cases of COVID-19 and 277 deaths among Chicago residents. That was an increase of 809 cases and 19 deaths since yesterday. So that 809 cases, again, it's a lot of cases, and obviously these statistics, every one of these is a person with a family that's worried, and we know that although at least 80% of people have a mild illness, they never have to go to the hospital, they recover fine, we know that there are people among those 809 cases who probably will get seriously ill, need to be hospitalized, and potentially some will die. So we never want to make light of the cases, obviously. But even where we're seeing 809 cases, that is a lot of cases for the health department to try to keep up with. We're still definitely on the upward trajectory. But where you think about our doubling times, if we've got more than 8,000 cases in total, even 800 cases, 10% of that is in line with sort of a 10-day doubling time.
Yes.
And that is some of that flattening the curve. So let's look at our two graphics that are always up at the top of our report every day. So first, this is what's called our epi curve, where along the bottom we have the dates, and then going up the left-hand side we have the number of cases. And I'll remind you that we always put our cases in on the day that they were diagnosed. And so that's why you can see that the latest day looks like it's lower. That's just because it can take sometimes a couple of days for test results to come in. We are seeing testing results often coming back faster. We're starting to see some of the rapid testing online. We're starting to see some of the hospitals with more ability to turn things around quickly, but the overall, still, it can be a number of days. Yes. And then let's look at the next graph. So this is our overall curve, and this is the one that over time we will need to see even more flattening, and then eventually it coming back down. So we're seeing a slowing in the rate of increase, but you can see we are still definitely on the way up. And a little bit later this week, I think potentially on Wednesday, we're going to be doing a much deeper dive into a lot of the data and really looking at some different graphs and different ways of understanding what our rate is like here in Chicago, and then what sort of implications that has as we think about, of course, shelter in place and how we're doing and all the rest of it. But really, as I say every day, the most important thing during April here is that we do everything we can to limit the increase in infections, and that means staying home as much as possible, not interfacing with people outside your household unless there's an essential need. I think our 8,584 cases in Chicago were among 20,852 in Illinois, and our 277 deaths in Chicago were among 720 in Illinois. Other than that, I encourage you to look at the website if you're interested in more demographic information about age or gender or race, ethnicity of cases, as well as more details about the deaths. I'll note that 165 now of the 277 75 deaths are in people older than 70. So really disproportionately continuing to affect that group. I think with that, I encourage you to take a look if there's more questions you have or things you're interested in. But Wednesday's going to be a bigger data dive.
Okay, so let's get into the questions.
Sounds good.
Right off the bat here, Angela Champ from Facebook. What if an individual elects not to be vaccinated? We've been talking about the work that's being done to develop a vaccine for COVID-19. Angela's question is, what if someone decides that they don't want to be vaccinated?
Okay, Angela, it's a good question. I think, first and foremost, of course, most of the focus is on having the vaccine in place and wanting to make sure that it is widely available. There will be a lot of work, not just to get the vaccine completed, but to get it manufactured and to think about what that rollout strategy looks like. And actually at CDPH, we already have lots of plans around what that will look like when it's available. But in terms of whether it will be required, it's an interesting question. What I would say is that typically here in the U.S., we do not require vaccination for all people. I don't think that would likely be different here, but often there are particular settings where vaccination is required. So we think about especially children in schools, right? Yes. By Illinois law, unless there's a medical reason really why a child can't be vaccinated. Broadly speaking, they need to be vaccinated. There's some potential for the religious exemption as well, yes. But that requires that you've had a conversation with the pediatrician, they've explained the risks and benefits, and broadly speaking, it is expected that children are vaccinated to attend school, and there's an understanding that if they are not vaccinated and there is an outbreak, for example, of one of the vaccine preventable diseases, the school is within its right to remove the child for as long as the outbreak is going on. So, of course, I don't know for sure how that will play out yet related to a COVID-19, but you could imagine settings and requirements perhaps to be in a setting. Healthcare workers also often are required to have the flu vaccine to be able to be at work in a hospital, for example, taking care of sick patients. And so there could be employer recommendations or school-based recommendations, or requirements rather, employer requirements or school-based requirements. But I think we'll see. Most people, of course, I think will be very interested in getting the vaccine. And so I think it's something that will in a lot of ways, I think the harder conversation is about how you prioritize it, right?
Yes.
Obviously, we'd be most interested in thinking about those older people with the underlying conditions. But at the same time, you're thinking about the people who would need to be out and about and doing the essential work. So there will be a lot of that. But we're a long way from a vaccine.
Yes.
We've talked about this. But maybe we'll just, if folks haven't been on, just high level. We've got 3 vaccines now that are in human trials, which is great, actually, very fast for a vaccine to already be doing that. I think there's another 65, 70 vaccine candidates that are just behind it, that are still in the laboratory stage, or perhaps
65 or 70 different types of vaccine.
Yeah, because here's the thing, we don't know for sure yet, which, we call it a platform, which platform of vaccine is going to work. So we talked the other day that there's a lot of preclinical work that's done, right, in the laboratory, and one of the reasons we were able to even get a vaccine into human testing so fast is because there had been a lot of work done around other coronavirus vaccines, especially for MERS, Middle East Respiratory Syndrome, and SARS, Severe Acute Respiratory Syndrome. Those are 2 other coronaviruses. And if you go all the way back to what the virus looks like, right, with those little spiky proteins around it, those spiky proteins turn out to be fairly similar. That's why they're all called coronaviruses. They look like a crown with spiky proteins. And so some of the vaccine work in the lab that was trying to target those spiky types of proteins, some of the scientists, this was one of the ones at NIH, one of the earliest candidates sort of took something that had looked like it would work in the lab for MERS, that's using those spikes, and then really started the first phase of a human trial, which is the safety phase, just to make sure it's safe and you're checking for side effects. I think 65 days in, which is really, really fast. Normally that would be years in. But the thing is, there's all different ways that vaccines work. So some of the really classic ones, like if you think about measles, that's just using sort of like a killed or a very weakened version of the virus. And the whole point is to teach your immune system, to help your immune system know what to do if the real virus comes. Yeah, so it teaches your immune system how to respond and how to protect you without actually making you sick. And so the most traditional way to do it has been looking for those kinds of vaccines. But because this one is actually it's an RNA virus, meaning that the actual genome, like the genetic code of coronavirus, it's what's called an RNA virus. And RNA viruses can change sometimes. We have not seen a lot of mutation here. That's been really important, and everybody, obviously there's a lot of attention in watching that. But we know that there will be some changes in the RNA virus. So there's new candidates, like these ones that are looking for spiky, that are actually, as opposed to trying to sort of take a killed coronavirus or a weakened coronavirus, they're actually just trying to target sequences of the RNA or DNA. There's a few platforms itself, and so you wouldn't even necessarily need to give a version. You could just say, I want
on the code.
Yeah, focused on the code, and then the idea is that, like, say that code is for that spiky protein. You teach your body to recognize that spiky protein and have the appropriate immune response. So, but we've never had an RNA or a DNA vaccine work before. Like, this is a new approach. And so, there's about 70 different candidates, and it gets complicated quickly. But those will all move ahead, because the idea will be to see which one or ones are safe and then are effective, right? These are separate. And then once you do...
And effective for some time.
Effective for some time. We've talked about this, right? It's no good to build a vaccine that protects you for 2 weeks or 2 months. Like, we need a vaccine that has enough longevity of protection. And it gives you, in effect, these same antibodies. Like the antibody test, that's your immune response. It teaches your body, again, it makes it think that it's had COVID, or it knows how to respond, and it like protects you if it sees the real thing again. And so phase 1 is safety, phase 2, and phase 1 will only have like maybe 80 or 100 people in it. And that first one started in Seattle. They check like your liver tests and your kidney tests, and they do some different doses, and they obviously look at your antibodies, and it's really just, is it safe? And then phase 2, you go out to maybe a few hundred people typically, and it's a much more involved, how effective is it? What are the antibody levels? How can this last? And then phase 3 is when you really move into thousands of patients, and those are the ones that really let you know, first of all, in case there's a side effect that you might not see in just a few hundred people. It allows you to check it. It allows you to widen the population. You obviously wouldn't start with a vaccine for pregnant women, for example. You'd start with young, healthy volunteers, but then recognizing you need this to be the most effective for the people most vulnerable, you got to wait till those safety and efficacy trials are done to do the larger scale ones. And so that's why, realistically, it probably, it's going to take at least a year to get to a point where we have a vaccine that is definitely safe. You have to be sure it will not give people COVID and will be effective. And then this may be, depending how the virus goes, you may need a couple of doses. It may be something where you need every year, every 10 years. We don't know yet, right? But this is some of the work of the different platforms. Then even when you have the platforms done, you got to manufacture it. Right? And like, if it's a new kind of vaccine, that's not so straightforward. So lots to go.
So the science here.
Getting into the science. We always get into the science. So I think, so for people who are not interested in potentially getting that vaccine where it's available, I think there will be a lot of people in front of you in line very anxious to get the vaccine. But there may be some requirements potentially to be able to do particular things in society. But that'll be a discussion for much further down the line.
We've got a while yet.
Yeah.
Okay. Let's see here, Katie. Oh, we have a couple of grocery store questions.
Okay.
So I'm gonna give both of them to you. One from Faye State from Facebook. Do grocery containers have to be cleaned?
Okay.
And the other from Katie Inboden Gingrass from Facebook also. Should we be changing our clothes after grocery shopping?
Okay, so good questions. We've had lots of grocery questions, but that makes sense because everybody one of the essential things
that we're allowed to go out to do.
Exactly, and we need people to do. So let's kind of hit on those and just sort of high level again, like safe grocery shopping. So first of all, people of much bigger concern than things, okay? So the first question was about wiping down the groceries?
Yeah, do the containers have to be clean?
Yeah. So that's not my biggest concern, I will say, certainly. If you think about going out and getting your groceries, mostly I want you focusing on the people and trying to keep your 6-foot distance, keep that social distancing. This is where, having some of that face covering that's mostly about protecting others from your germs in case you were asymptomatic, you were not having symptoms and you were out. Trying to avoid the crowds, trying to shop relatively quickly, right? Go with a list, know what you're gonna get in there and sort of get out, and try to go alone as much as you can. That's another thing. I think you really don't want to bring 3 kids to the grocery store if you can possibly avoid it. You think about where more people go, you've increased the risk in general, and where we can, you wouldn't do it. I think any opportunity that you have to clean your hands, to sanitize your hands, to sanitize the cart, if you've got some hand sanitizer or whatever, be using that.
And there are some grocery stores that are actually spraying the carts and taking care of that.
There are. But if that's not available, like we've said, the germs do not jump from from the grocery cart handle into your eyes, nose, mouth. That's not how it works. You touch them with your hands, and then you touch your hands with your you touch your eyes, nose, mouth with your hands. And so, like the other day when I was in a store getting some things, I was just really conscious of my hands and mostly just trying to not touch my eyes, nose, mouth, and made sure that I washed my hands before I touched my eyes, nose, mouth. I think where you think about sort of getting home and some of the grocery, sort of washing the groceries, it's not the primary concern, honestly. If you think about, we've talked a lot about the surfaces, and say you had like a cardboard box. Yes, we've shown that it is possible for virus to potentially be on cardboard for 24 hours. But that means that you touch the exact spot, like on the box where somebody sneezed, sort of within the 24 hours, and it's viable, and it's enough to then, you also have to touch your eyes, nose, mouth with it. So I don't do any wiping down of groceries myself. I will just say I'm mostly concerned, again, about the hand hygiene around it. I think if people are particularly concerned, if you bring something home, it doesn't have to go in the refrigerator. Just leave it on. You could leave it on the counter for a day or two, and at that point there really would not be major concern. Also, if you're cooking things and heating them up, you're killing the virus. Yeah, I would not. We get questions about gloves a lot too. Gloves are not magical protection devices for you. Gloves, if you have them on, it's kind of like the masks. Sometimes people think, oh, I have gloves, I'm protected. But the problem is, all the glove is doing is meaning that if you touch things,
it's picking it up.
People don't do a good job of washing gloves. The gloves get cleaned, they don't get cleaned in the way hands do. And then you touch your eyes, nose, mouth, you've actually had more contamination there potentially. So I don't want people thinking they have to wear gloves and that will necessarily be a protection. People do wear gloves, please peel them off. Don't be touching all over the inside of your gloves, but mostly just wash your hands.
And throw them away.
And throw them away, right. We got the question the other day. Don't throw them on the sidewalk. Just throw them away regularly. But wash your hands. If you wash your hands before you go in the store, if you have opportunities, in the store, and then again when you get home, I think you'll be fine.
What about this notion of changing your clothes?
Oh yeah.
Not only going to the grocery store, but say you're an essential worker and so you've been out. Is there a need to change your clothes when you get home?
Yeah, so I don't do sort of a big personal decontamination of taking off my clothes or showering immediately after I get home. I'm not a healthcare worker, so I'm not regularly sort of in settings where you might be exposed more, right, to active people with COVID. And personally, I don't put my eyes, nose, mouth on my clothes a whole lot. So I think, again, in terms of what that contamination sort of looks like, the risk just sort of in a grocery store, for example, is not particularly high, especially if you haven't brushed up against things. And again, it's like the people are really more of the concern than the clothes.
Yes.
I mean, if you got little kids, right, who certainly do put their eyes, nose, and mouth absolutely everywhere, right, maybe you might do a little more of that. But again, it's not the main concern. So these are all things that you add on, depending on your level, of concern related to it. But washing.
We get back to the basics.
Getting back to the basics.
Stay home.
Stay home.
It's stay distant.
Stay distant.
And good hand hygiene.
Good hand hygiene. And if you are trying to do any washing of your groceries, please don't try to go with crazy disinfectant sprays. There can be real
because probably some produce could absorb that.
Yeah, produce, water. Clean your produce with water. Do not be putting soap and bleach and God knows what on your vegetables and your fruits. You should be eating fruits and vegetables. They're healthy for you. There's no sign that coronavirus is sort of more on these. But if you're putting these, I mean, even soap can give people diarrhea and stuff. But a lot of the other things are absolutely not designed. Again, anything that's not designed to go on your body or in your body, don't put it on or in your body. So wash your vegetables, brush them off if it's the potatoes and whatnot like you would, but please don't start trying to use disinfectants in not the right ways. So pay attention to washing your hands. Some of those other things would be extra, but it's fine to go to the grocery store if you need to go to the grocery store.
Okay. Eva Jelazova Eva Jelazova from Facebook. Knowing that coronavirus can stay in the air for 2 to 3 hours after someone coughs, how high is the risk of this in closed places like grocery stores?
More grocery store question.
There's another grocery store question.
So again, let's kind of go back to basics. The biggest concern is having at least that 10 minutes of the contact within the 6-foot radius with someone. So, keep your distance from the cashier. Wear your mask to help, again, have fewer germs sort of coming out. Try to keep that distance. It is, again, sort of in the risk order of things, it's not it's not the highest concern, obviously.
In terms of someone's cough or sneeze hanging in the air.
Yeah, it's, most of the virus, certainly it settles down as droplets if somebody does cough or sneeze. And we've talked before about, there's still a lot of questions about how much virus you even need to inhale to be able to sort of have been infected with the virus. So, as always, being home and not being in touch with anybody is the safest thing, right? That is the safest thing. But if you need to go out for essential reasons, then keeping that 6-foot distance, keep the face covering on, do the hand hygiene is really the most important thing.
Okay. Deborah Schechter from Facebook, how will it be determined if someone who has had coronavirus is immune?
Okay. So this gets at the antibody testing, which we've talked about a number of times on here, but maybe it's worth doing just a little bit of review. So there's 2 main kinds of coronavirus tests, right? At least right now. There's number 1, the kind that is the nose swab or the back of the throat swab. That is known as molecular testing or PCR testing. That is actually looking for virus. And so that is the one that is approved by the FDA to be used to diagnose COVID. We've talked about that there can be occasionally false negatives for that because it can take up to 14 days to develop symptoms. And so really the recommendation is to use this test primarily in people who have had symptoms. And if somebody's had a significant exposure, a negative test doesn't completely rule it out. But a positive test of this PCR nose swab is what is approved for testing diagnosis. So that's the one that should be being used for clinical diagnosis. Like if you go to see your doctor, that's the kind that you should be getting. The serology testing is the other big class, and again, it's got sort of different names. Number one, this is the one that's in the blood. So as opposed to a nose or a throat swab, this is the one that's a finger prick or a blood test. And as opposed to looking for the presence of virus itself, it's looking for the immune response to the virus. So it's looking for the antibodies, and there's a couple different kinds of antibodies, but
so it's able to know if your body has already fought.
That's right. That's
COVID.
right. However, there are really limitations still in terms of the that kind of testing, and so I do want people to know that there is no antibody test yet that has been approved by the FDA for clinical diagnosis or for clinical use yet. You heard me talk about with clinical partners, we're starting to do a little bit of that here because we want to see how it performs, but with the PCR test, the nose test that is approved for diagnosis. So there have been issues in other countries, and I think even potentially here, there's been such a lot of anxiety and desire to get testing going that there are people who are starting to use these antibody tests before they've been FDA approved. And so they're going to be incredibly important. They're going to be what we use at a population level to really answer some of these questions. But what's available right now is still not appropriate to fully answer that question because number one, it definitely has false negatives. So again, a false negative is where you get a negative test, but actually you're infected. And that's because antibodies take even longer to show up than the virus does, right? So you actually have to wait a certain number of days before you would even trust an antibody test at all. It's fine if you think you had symptoms in, February or March and you didn't get tested, we'll be able to test you later. Like once there is a full FDA approved test, it's not like that goes away, we'll be able to test for it later. But I don't want people thinking that it's quite ready for full prime time yet, because the other problem is it definitely has false positives. And here's the concern, is that at least in some of the versions, again, there's like all these competing companies, we gotta wait for something to be validated and approved. There's a concern that we've talked about how COVID-19 is just one in a family of coronaviruses. So yeah, there's MERS, there's SARS, but there's also a lot of different coronaviruses that cause like the common cold, right? Probably 10 to 15% of the common cold is caused by these very innocuous, they're not dangerous coronaviruses. And the problem is that the antibody tests do not reliably distinguish yet between COVID-19 and these other coronaviruses. So you could go and get an antibody test and say, oh, I'm fine, right? Look, I must have had COVID-19 and I'm sort of good to go. No, maybe
you might have had the
common cold
was a corona.
that wasn't the COVID-19, and you could have this false sense of security. And so really, I don't want people yet using these antibody tests before they've been validated. We can use them in conjunction with that PCR test, but if you're going to see your doctor, you're going to try to get testing, it should be in the setting of having had symptoms. Because if you haven't had symptoms and you just get an antibody test, it is really a big question mark of what that means. And there will be, in the same way, there's like 70 different vaccine candidates that are being tested. There's probably at least that many different antibody tests and companies that have sort of put theirs forward. And we saw in some other countries that there were examples of going too fast and sort of using antibody testing that turned out to not be very accurate. And so I know everybody's really anxious. Trust me, I'm one of the most anxious to have a validated antibody test that will help us understand some of this at a population level, but there are still some limitations just right now. So I think it's important for people to understand that.
Yeah, I think the main point I'm hearing is it hasn't been approved as a tool for diagnosis.
Right, not as a tool for diagnosis. There are, there's some ways that we're using it kind of from a public health standpoint, but it by itself does not tell you. And the other thing is, I don't want people thinking, oh, I'm a healthcare worker, I have this, I don't need to wear my PPE now, right? I don't need to keep my social distancing, I don't need to wash my hands. No, because even if there are some antibodies, we've talked about there are still questions about how long those antibodies last. Do you have complete immunity or partial immunity? So we just really want everybody being careful. It's good. I would guess we'll see an antibody test approved by FDA really in the next couple of weeks. I think it's going to be really soon. But it's just a little bit premature, and everybody's anxious. But
and everybody wants to get tested.
Of course.
So some caution there.
Yep.
All right. Miguel Delgado from Facebook, what is your take on boosting with vitamin C? I'm assuming boosting your immune system with vitamin C.
Yeah, so I answer questions like this all the time. So, you know, my biggest concern is that people are trying to use unproven ways to protect themselves from coronavirus. Vitamin C is something that I know people like to take to try to, you know, boost their immune system or protect themselves, you know, if they have a cold or they're not feeling well. You know, vitamin C in a normal dose is not really hurting anything, but I also don't think there's any real evidence that it's doing a whole lot to protect you against COVID. So what I don't want people doing for vitamin C or any other substance is really like being like, oh, if a little bit is good, let me take a lot. Like, you know, I see this just in my practice regularly, putting aside COVID for a minute. People think that just because something is a vitamin or because it's available in a health food store, that it's safe, that it's no problem. And depending, you know, vitamin C is one of the, you know, you'll just pee it out if you sort of take too much of it. But there are other things that like really, you know, I mean, potassium, for example, like I have patients who say, oh, I have some leg cramps, I'm going to take a bunch of potassium. Potassium can absolutely mess with your heart rhythms and can be even fatal in high doses. And so we've talked about this a lot, like there is not a proven, again, lots of studies. In the same way there's probably 70 vaccine studies, there's probably 300 at least studies going on right now around the world about different treatments, different prevention. But I don't want you starting to take something you don't normally take. I want you taking things that you would regularly take in the regular doses. Don't change any of that, I would say, broadly related to coronavirus.
Yeah. So do everything that we normally would do.
Do everything you would normally do. You know, the amount of vitamin C you're going to get in oranges or in a daily multivitamin or something, great, like no problem. But don't be sort of looking online for some miracle cure. There are a lot of scams out there right now, I will tell you, and some of them have the potential to really be dangerous.
Okay. Tasmin Manuel from Facebook. What about confirmed COVID-19 cases inside of nursing homes? Can the residents be sent to McCormick Place for treatment?
Okay. So cases within nursing homes, or what we call long-term care facilities, are a huge problem.
Yes.
They've been a huge problem since the beginning of COVID-19. They're a big problem here in Chicago. We at the Chicago Department of Public Health, you know, we work with all of the nursing homes. We've sent personal protective equipment to all the nursing homes. We've sent guidance. We've had lots of calls. We've been on site in some cases. But you can imagine, you know, the problem with nursing homes is that they're, again, what we call a congregate setting, meaning these are common spaces, and these are people's homes.
Yes.
So they're not able to sort of isolate in the same way, usually because if they're in the nursing home, they're needing additional hands-on care, right?
Yes.
Which again, there's some risk. So, you know, staff should be masking. There's lots of pieces that sort of go along with this. But
so a lot of residents actually are in that category of individuals with those risk factors, the chronic conditions.
Absolutely. Right. You look at you know, the average age in a lot of nursing homes, or even if people are younger, they usually have really serious underlying conditions. So they're one of the settings we're the most worried about and have been really aggressively working with the many that are here. But we've seen a lot of deaths already come out of nursing homes, and I'm sure that we will see more, not just here in Chicago, but you know, really around the country. And so,
we've seen some spread in some of those settings too. I remember very early on there was one, I think, in one of the suburbs where there was
exactly, there was, yep. And so, where we think about sort of what happens when someone is diagnosed. So we would not send them to McCormick Place because McCormick Place is not a true hospital. It's what we've been calling it an alternative care facility because it's not designed to specifically accept patients from the community. It's designed to be a transfer point from a hospital. So a patient at a nursing home or anywhere else who is sick, let me tell you, those staff are paying a lot of attention to if anybody in a nursing home gets a fever or is getting new symptoms. They're working really carefully to make sure that they're isolating those folks from the other residents and that they're arranging testing, and that if anybody's sick, working on transferring them to a hospital, to an acute care hospital, because again, these folks would really fall in that vulnerable category. And then they would be at the hospital, let's say they had COVID or not, they would be there until they were really doing better and able to return to their home, which in this case is the nursing home.
Yes.
Primarily.
Okay, all right. Lizzie Baker from Facebook, if a coworker has a low-grade fever for 5 to 7 days, can management ask for a doctor's note before they return to work?
Okay.
I know that we've talked about you shouldn't return to work if you've had symptoms until they've been gone for 3 days, right?
Yes, until they've been,
72 hours.
72 hours, right. But also a minimum of 7 days, and then the 3 days without symptoms, right. So again, it is the law right now in Chicago. You go right to the chicago.gov/coronavirus website. Right up at the top, you'll see, I think it says orders, and the orders are the new laws that have been put in place for coronavirus here in the city of Chicago. And the very first one that we did was the one that mandated that you must stay home if you have new onset of fever, cough, shortness of breath, nasal congestion, body aches, sore throat, or unusual fatigue. I have to run through those a fair bit, so that's why I know them. The point is, if you're even starting to feel sick, you must stay home by law. And it says right in that same order that, as you said, it has to be at least those 3 days without symptoms. If somebody's having a fever right now, I would have some concern that they might have coronavirus, right?
Yes.
Certainly. And so in that setting, the person must stay home, that minimum of 7 days since the fever has started, and then since the symptoms have started, and then again, at least 3 days without symptoms. So they can return at that point. They should not need a doctor's note. Like if there is we don't want people going to the doctor just to get a doctor's note. That's why there's guidance up on the website. You can point employers to that order. You can point employers to the language on the website that talks about the time you need to stay out and when you can return. So certainly be in touch with your doctor if you have questions about that. We want you talking to your healthcare provider if you're feeling unwell, especially if you've got underlying conditions or there's any concern. But I would not want an employer to require a written doctor's note that would require someone to have to leave their home and get healthcare and go into a setting where there could be an exposure for risk without need. So that would be my recommendation.
Okay. Nick Obasi from Facebook, when it warms up, is there any chance this virus will be less likely to infect people?
Yeah, so that's a big question. That's been a question really from the beginning. We know that a lot of viruses have a seasonal pattern to them. So you think about flu season, right? Cold and flu season. It's in the winter. Yep, and some of that has to do probably with the fact that most viruses, they don't like warm outdoor temperatures quite as much, but also it has to do with what happens in the winter. What happens in the winter is that we're all inside a whole lot more, and we're having a lot more contact with each other sort of broadly, and there can just sort of be more spread. So it's a mix of sort of the
weather and just transmission.
The weather and transmission. And so the thing is, we've seen plenty of coronavirus in the southern hemisphere where the seasons are flipped. So in Australia, December, Christmas time, is like the height of summer. And in their, January, February, March, that would be summer, spring, whatever. That would be warm times for them. That would
the opposite of now.
The opposite of now. I guess that would be fall, sort of heading into the winter. But it's warm, and Singapore is like 80 degrees, most of the time, and there has been plenty of coronavirus transmission there. So we don't know yet, because we have not had this virus long enough to be able to know what role
Kind of what
seasonality
the
may
cycling
play.
might
Yeah,
be.
and so there is some possibility that we could see decrease related to the summer months and then increase in the fall. But I think in a virus that spreads the way this one spreads, in where the entire world is not immune, we can't just assume that summer weather is going to be enough to really limit this. But it's one of the biggest questions for sure, and you'll hear people kind of debate about it. But the bottom line is we don't know the answer yet.
Yeah, and while we're in spring, even if we have summer-like weather, please stay
Yes,
inside.
absolutely. Yeah, can't say it often enough.
Yeah. Okay, so I think we're going to turn our attention to some good stuff.
Okay.
I wanted to just highlight that even though our Chicago Public Library buildings are closed, the library is still open online. So you can go to chipublib.org. That's chipublib.org. There are ebooks, audiobooks. You can even get a library card right now if you don't have one. So the library is open online, and we just want you to, especially those of you who are at home with young children, with kids, point them to the library. It's open.
Yeah, great, thanks. I love, I don't have any time to read right now for fun, but during normal times, I love taking books out of the library online. It's amazing. So I have a couple, thank you for people who sent in some nice things that happened around Chicago related to Easter. So we had someone write in and say that my neighborhood, Forest Glen, usually has an egg hunt for the kids. And this year, the Black Club asked folks to decorate their windows with hand-colored paper Easter eggs for kids to see. Someone dressed up as the Easter Bunny, walked through waving to the kids, just sort of made it a fun thing. We heard that in Melrose Park, there was a drive-by Easter Bunny, apparently with the sirens, with the police or the fire, maybe both, really making sure everyone would sort of see that. And again, kids were in their homes, but able to
Yes.
have some of that. And then up in Rogers Park, I guess there's something called the Red Door Shelter that is a local rabbit shelter. And there's a problem this time of year usually where people will think, oh, it's Easter time, and they will sometimes they'll think they want to have a rabbit for a pet and then not always want to keep it. And so this shelter sort of comes to mind during Easter time. And anyway, they needed cleaning supplies. And so they posted it on Facebook, and apparently community members dropped off 65 donations of paper towels and bleach right to the shelter's doorstop. So they were able to really, again, kind of in an animal shelter situation, keep the rabbits and the other shelters and the human caretakers really safe and clean. So that was a nice Easter story. And then Paws Chicago, P-A-W-S, is offering a crisis care foster initiative. So if for healthcare workers who might be working around the clock and maybe don't have as much time to take care of their pets, or for people who might be recovering from the virus and having trouble, or people who are experiencing financial hardship and are worried about having to pay to feed their beloved animals at the same time, they're offering temporary foster homes for cats and dogs. So interested pet owners have to go online, go to Paws Chicago, and you put your information, and then Paws will help place you with a temporary foster family. And then if you're interested in potentially fostering a cat or a dog to help someone out at this time, that is also on the homepage. So pawschicago.org. We talked, I think, last week about, we'd had really nice uptake of people adopting dogs out of the Chicago Animal Care and Control Shelter, but here's a nice sort of foster initiative that again was I think a good idea. So yeah, we love getting these stories of the ways people in Chicago are coming together, rising above what is a really difficult time for everybody, and thinking about creative ways to reach out and support people who are in need of support right now.
Yeah. So keep those stories coming. You can send them to us using the hashtag #AskDrArwady. Keep your comments and your questions coming as well. We'll be back again tomorrow.
We will.
At 11. And we will pick up where we left off. In the meantime, we want you to stay home
and save lives. Watch at 1 o'clock for the press conference if you want to know some more about what we're doing, especially among Chicagoans who do not have stable housing.
Thanks for being with us.